When you have a diagnosis of multiple sclerosis, you'll sometimes feel like people aren't listening to you or hearing what your needs are. That can include your doctor, it can include the insurance companies and others in your life that you interact with. Neil will talk about some of his problems with these issues and how he overcame them and how it just helped to have people listen and answer his phone calls.
Hi, my name is Neil. I was diagnosed with multiple sclerosis about 2 years ago. What I didn't realize when I was diagnosed was that it was actually the start of two different journeys for me. One was dealing with multiple sclerosis and being a patient, and the other one was dealing with pharmaceutical companies, insurance companies, doctors' offices, specialty pharmacies, and all the other stuff that kind of comes in between. In fact, when I was diagnosed, I didn't even know what a specialty pharmacy was, never mind how much time I would have to spend on the phone with one. At first, when I was diagnosed and my doctor sort of brought me through all of the different options that I had for medication, all the different sort of ideas that they had about what treatments I should be on, I was sort of locked in, paying attention, reading about it, chose a medication. I had never heard of a pre-authorization before. I assume that a lot of people when first diagnosed with something like MS have never heard of a pre-authorization for a drug. Every time I'd had oral surgery, I'd just take the prescription, I'd go to the pharmacy, they'd give me the medication, and I would be fine. So I had no idea what I was in for. My doctor sent off the pre-authorization to my insurance company, and days go by, and I hear nothing. And that is so, it's so nerve-wracking as somebody who, A, is trying to deal with just being diagnosed with MS. Now I have to sit here and wait and not really know what's going on. So finally we hear back from the insurance company and they say no. Not particularly any reason given to why they said no. They just said, no, we don't want you to take this medication. We'd want you to take the other one. So I am a little bit stubborn, and I thought to myself, I don't want my insurance company deciding what treatment I should be on, deciding what medication I should be on. I'm pretty sure my doctor is a better person to decide that for me. So I call up my doctor and I say, I want to do the treatment that we decided on. I don't want to do the one that my insurance company wants me to do. I'm not some sort of decision on an actuarial table. I'm a person who talked to their doctor and decided what treatment to take. So we decide to do an appeal of the decision. And I'm sure that many watching are familiar with this process. So the doctor sends the appeal off, and then we hear nothing. So not hearing anything back, I decide I'm going to take matters into my own hands. I call the insurance company. First time I call the insurance company, oh, we haven't received the appeal yet. So I call the doctor back. Oh, well, we sent it. I don't know why they haven't received it. We'll call them back. The doctor is totally helpful. Their office is great the whole time. I'm just sort of impatient and trying to kind of take matters into my own hands. I feel like if I'm going to be the one with MS, I should be at least aware of the whole process. So a couple days goes by, week goes by, still don't hear anything, call back the insurance company. We haven't received an appeal, we never received a pre-authorization. Well, that's frankly not true. So I'm on the phone for 45 minutes with them at this point. It was a half an hour the time before that. All of this is happening when I'm at work because I still have a job. So I am kind of trying to juggle all of this stuff at the same time. And throughout the whole process, what I really realized is that having MS and the disease is not the most stressful part of kind of this journey that I've been on. One of the reasons that I know that is because I had a relapse last year of optic neuritis. Once the kind of vision started closing in my right eye, I wasn't super stressed out about it because I knew what it was, and I knew that I had to call my neurologist and probably go on steroids, and then maybe we'd have to change treatments or whatever, but I knew exactly what was going on. With the insurance companies and the pharmacy, I just had no idea. And every time you'd call the insurance company, you'd get a different answer. Finally, I called them back another couple days later after they told me that they had no idea what I was talking about. And yes, of course that we had the pre-authorization. Yes, of course we had the appeal, but we haven't decided yet. When are you going to decide? Well, it's going to be a couple weeks. Meanwhile, I'm dealing with MS, and I'm untreated and have no idea how long before my next relapse. They've kind of been accelerating up until diagnosis, and now I need to wait another couple of weeks. It turns into a thing where you are sitting there staring at your phone, staring at your email, frantically checking the mailbox every day, just waiting to hear back from somebody about something. Just because it grows this sort of knot in your chest of what's going to happen, what's happening now, why is nobody making any decisions, why does it take a few weeks to say yes or no to this medication? And this went on for weeks and weeks and weeks and weeks and weeks before I was finally able to start the treatment that I needed. Like I said, several months after I probably should have, just because the insurance company didn't know or didn't want me to be on that particular drug, the one that my doctor and I had decided that I should be on. As a patient, and as I said, as somebody who had never dealt with pre-authorizations before, never dealt with a specialty pharmacy before, I could not care less about a drug formulary. I only really care about my health and what my life is going to look like over the next few years, and making sure that I was on the treatment that I and my doctor wanted me to be on. So I think that the issue that this comes down to isn't just dealing with insurance companies. Everybody knows dealing with insurance companies is going to be difficult. I think it's the lack of communication throughout the process that really hurts me, the patient, us, the patients. Not having sort of an up-to-date idea of what's going on, sort of taking my future, putting it in the hands of all of these different groups, and just saying, throwing up your hands, shrugging, and walking away and just waiting for an answer. It's not great. And having MS on its own is stressful enough. Having to deal with that at the same time does not make it any better. So I think that that's where this one hole exists. And in 2017, it's not a hole that has to exist. There has to be a way to improve communications. And it doesn't need to be your doctor or their receptionist or their staff or whatever calling you every 30 seconds, emailing you every 5 minutes. We live in an age of technology I should be able to, every time I need an authorization done for either an MRI, a new medication, a course of steroids, if I need to go on a course of steroids, I should have an app on my phone that I can just pull up and see when my doctor sent it off to my insurance company, what the insurance company said, where it's sitting. We live in this age of constant communication and constant updates. This is something that is so important, and we're falling through, like I said, we're falling through this hole where, we just don't know what's going on. We don't know, it's not good to have to deal with that stress. Wasn't good for my productivity at work, and it especially wasn't good for my productivity at work to be spending, hours and hours every week, hiding in a conference room somewhere on the phone with my insurance company, making up lyrics to their hold music because I'd heard it so often and was getting bored. So I just wish that my doctor knew what it's like not only dealing with MS, but also having to deal with that not knowing and waiting to hear back from somebody. Thank you.